Concerned today about the future of children's health care. A local congressman says he's worried that if the Republican health care bill passes, millions of children could lose their coverage. KCAL 9's Randy Page is live at Children's Hospital LA with more. Randy?
Well, critics here at Children's Hospital of the American Health Care Act say one of the strongest ways they can make their argument is to introduce us to some of the children who could be affected by this new proposed law.
It can be difficult for people to understand the way I speak.
Connie Morales uses her eyes to communicate. When she looks at a letter on this keyboard, it appears on the screen. So she shares her thoughts one letter at a time. How is she feeling today?
Good, but worried.
Connie is one of the current and former patients at Children's Hospital Los Angeles who participated in a news conference today to say they're worried about the impact the American Health Care Act could have on themselves and the children around them. Congressman Tony Cardenas says he's worried too.
If Congress cuts $1 trillion out of Medicaid, we will not have to go to a foreign country to see a mother with a dying child in her arms.
Congressman Cardenas says the AHCA, as it is currently written, would jeopardize the federal and state funding used to cover the medical costs for nearly 10 million children in California, including Connie Morales.
I know that I can't afford it. And my daughter's come a long way. She's already gone to college. She's made the dean's list. I cannot put her in a home, because if you're in a home, you're gonna die.
People need to realize that money isn't and should never be more important than the health of human beings.
We reached out to 5 Republican congressmen here in Southern California for comment. Only one responded saying that he wasn't available. But we did speak to one staff member who said it's difficult to comment on a bunch of what-ifs, pointing out the bill is now in the Senate. It's likely to change a lot, and we have no idea yet just what those changes might be. Let's take it back to you.
All right, Randy, thank you.